Do you have that pain in the neck that just won't go away? I'm not that annoying relative that keeps showing up on your storage step. I'm talking about the kind that is at the root of those reoccurring headaches that sometimes can be debilitating. Dr. Craig Livesay from the Spinal Corrective Center says that you can get some relief from those with the help of chiropractic adjustments. Welcome back.
Glad to be here.
So it's all in the neck.
A lot of the times headaches are actually coming from the neck. I know we get all the information from the news and everything that there's all these stressors or lights, foods or scents can actually trigger the headaches. But what a lot of people don't realize is a lot of times that pressure is coming right here in the neck. And that pressure comes from our poor posture. Everybody's got the cell phone, smartphone, they're looking down all the time. And even in the way they sleep, this neck gets twisted and it can kind of bind up and put the pressure right here at the base of the spine. So when people develop these headaches, they're treating, well, let me back up. The headache's more like a check engine light.
Oh, okay.
Okay, so that's coming on telling you something's wrong. And the way that people, they think they're fixing it is by taking a medication, where it's Tylenol, aspirin, but that's like putting a piece of tape.
Masking it, huh?
It's putting a piece of tape right over that check engine light when we should be actually getting to the root of the problem, and we can do that through chiropractic. Okay. And actually, I think we brought an x-ray.
Yeah, we've got an x-ray. You can see that there's supposed to be more curvature in there, right?
There's supposed to be more, and it's upside down. That's interesting.
Oh, sorry.
But on the picture, there's actually a curve. We can go back to the spine here and see that there's supposed to be a curve this way in the neck.
Right.
What that x-ray was showing is a lot of the patients that come in that have recurring headaches, their neck curve is actually going in that direction.
Oh, my.
So that puts a lot of tension. Actually, look at it like a banana.
Right.
If you had a banana and you bent the banana in the wrong direction, it's going to crack open.
There you go.
And then the way we do this with our adjustments, which you've experienced, we've done here on the show, is with the Pro Adjuster. No popping, no cracking, no twisting. It puts the impulse directly into here. That helps bend that curve directly back into the neck, and we fix the problem. The headache goes away.
And it's not an electrical impulse, it's just a tapping.
Less than 5 pounds of pressure, just that pulls the pressure right back out of the neck.
So does it take more than one adjustment to get these results?
You know, actually, I was looking, there's a 2010 Duke study that showed when patients get an adjustment to their neck, they can experience relief up to 4 to 6 weeks later. So it's not just that one and done sort of thing. They actually can maintain that alignment and reap the rewards weeks and weeks down the road. So they don't have to be there every day getting the adjustment to keep the headaches away.
But with years of misalignment, it might take several adjustments to get it back to where it needs to be, but you can get that relief pretty quickly.
You get the relief pretty quickly, but it's not going to happen overnight, especially if it's been 20 years getting to that point. It's going to take a couple more adjustments than that to get that pulled back in the right direction.
All right. Well, if this sounds like you, then you need to go visit Dr. Craig over at the Spinal Corrective Center. Not the whole house lighting. That won't help this at all.
That's
not a lick, but Spinal Corrective Center, it's across from the mall in Johnson City. There you go, or you check them out online. Craig, thanks so much.
Thanks.